Hi, everybody. It's Dr. Dixon here, and we are getting ready for our second Aging Well Together podcast. Today, we have John Madondo, who is the president and CEO for the United Healthcare of Massachusetts. It's going to be an exciting conversation about the work that United Healthcare does and the background of John Madondo. We look forward to being with all of you soon. But in the meantime, happy holidays and stay tuned for our second episode of Aging Well Together. Thank you. Hi, everybody. It's Dr. Dixon, and we are filming our second episode of our Aging Well Together podcast. And this podcast is about everything aging. It doesn't matter if you're 5 years old or 55 years old. We want to have a conversation about the issues that matter the most to young folks and older folks alike. And today, we're very fortunate to have my friend, John Madondo, who is the CEO of the United Healthcare for Massachusetts, here with us today. And so welcome, John. Thank you for joining us here today. I know it's been quite some time that we've been trying to coordinate this podcast, but so happy that we're able to do it today. And we'll just start the conversation by having you introduce yourself, your background, and then we'll go into our partnership here with United Healthcare and the Central Mass Agency on Aging.
Thank you for having me, Moses. You're right, it's been a long time coming. But finally, we're here and looking forward to having this conversation with you. A little bit about my background. I'm a nurse, originally trained as a nurse, and then as a nurse practitioner. And after having worked in multiple places in nursing, I also went into business and was doing home health for quite some time. Had a business in Tennessee called Warm Hearts Care that I, with a number of family friends, grew across the state of Tennessee. And then after a while, started a nonprofit organization doing similar work with an organization called Tennessee Personal Assistance, which still runs today as a nonprofit. And then a little bit, a number of years later, got into working as a nurse practitioner with three other nurse practitioners actually. I opened a clinic that we called Nurse Practitioner Associates and did some work in that area as well. So my long history of clinical work has served me well. I use that history and experience today in the work that I do.
Yeah. So you mentioned Tennessee. So could you talk a little bit more about where you went to school and how you ended up choosing, the school that you went to, and we'll talk a little bit more about that.
Yeah, certainly. I sometimes I tell people that I am from Tennessee, but really I actually grew up in Tennessee. My home country, where I was actually born, is Zimbabwe, a small country in southern Africa. I grew up there, came here to go to college, and when I came, the first place I landed was Tennessee. And the reason for that is my aunt, my mom's younger sister, is a physician. She's also married to a gentleman from Ghana who's also a physician, and they were both practicing in Tennessee. So that's where I landed to go to school. And I went to a historically black college, Tennessee State University, go Tigers.
Yes.
And so that's where I did my nursing schooling, both my bachelor's degree in nursing and my master's degree in nursing.
Yeah, absolutely. Shout out to HBCUs. I'm a graduate of Howard, go Bisons, and I know Oprah
Yes.
Winfrey went to the university that you graduated from, so certainly a connection there with our historically black colleges and
Certainly.
universities. So you've been in Massachusetts how many years?
So this is my second year, actually 2 years and 5 months now that I've been in Massachusetts. So I feel like I cannot say I'm new to the area anymore. I've gotten to know a lot of great people while I'm here. One of them being you, and the great work that folks are doing in Massachusetts. So
Yeah, absolutely.
looking forward to talking a little bit about that too.
Yeah, absolutely. So, I think that's a good segue to talk about how we met, the unusual or the usual way now in this day and age of how we met. We actually connected through LinkedIn
Yes.
a little over a year and a half ago. And, it was based upon an article that you had saw about what we were doing with the Grandparents Raising Grandkids Resource Center. And we connected from there, and we really began to spawn about how we could work together through the work that you do at United Healthcare. So could you talk a little bit more about why you were so interested in working with us, particularly around the issue of grandparents raising grandkids? And I know you have a strong caregiver support background.
Yes. So coming into a new market, I had been working with United Healthcare back in Tennessee, and the work that I've always done, honestly, if I think back, when I graduated out of nursing school, my first job was at a nursing home. And so that was my experience, my first experience working with older adults. And one of the things that I really loved about my first job is it gave me an opportunity to see people who were in need, not just health-wise, but also emotionally. One of the things that I often ask people, right, is if you think about it, if we were in a room today and we had 100 people sitting here with us, and I asked the question, who's looking forward to their first day at the nursing home? Most people don't raise their hand, right? This is a place that most of us don't really think about, ending up. And so for people who end up in those particular situations, it's either because something has happened, they've lost function enough that they need that level of care, or they don't have the necessary supports or the ability to age in place or age at home. And so that experience was something that really was that touched me, because in the country that I came from, nursing homes are really limited. A lot of people are taken care of by their families. And so it was an interesting way of taking care of people for me at that age and learning about it. But I also realized that we were doing really good work. From there, I went on to join an organization that was doing in-home care. So when I graduated as a nurse practitioner, one of the first companies that hired me was a company out of Kentucky called Health Essentials. And Health Essentials actually used to do home care in people's homes. So we did primary care in the home setting, and I got to start to visit people in those settings. And what you also discover in those situations is that many of us are not prepared for the time that is coming, right? So when we age, we start to realize, it's difficult to get into my shower.
Yeah.
Now I'm not able to cook. The stove is too high, or my steps are too high, and I'm not able to, get in and out of my house safely. And so one of the things that I started learning in that environment is that there was a lot that we needed to do if we were going to keep people out of the nursing homes. How do we support people to age in place? What kind of services do we need to provide? And as I visited those homes, I started to encounter people who were getting care from organizations, and that's how we started the home health agency. And then from there, as a nurse practitioner, also providing care to people, I got to learn that there was a lot more that we could really do. So coming into Massachusetts, I had all of that background. Yeah. I had been doing that work, and so when I saw the LinkedIn post, as you said, about grandparents who are taking care of grandkids, that was an area that I had not quite seen somebody really address. And so that was very interesting to me. And I wanted to hear more about it, which is why I reached out. And I wanted to hear what you guys were doing here. In all these experiences that I've had, that is something that I saw when I visited people in their homes. They needed care, but they were also caring for a grandchild.
Wow. Yeah.
Either a grandchild that was being dropped off at their house after school or on weekends, or maybe a family member who was no longer available, and the grandparent now had the responsibility of that child. And what I noticed is that there's really not a whole lot of help that older people get with these children. And so that's why I was really interested, and I wanted to hear more about what you were doing here. And the rest is history.
Yeah.
Because now I've learned quite a bit, and now we have an opportunity to work together.
Yeah, absolutely. Not only have you learned quite a bit, but you and United Healthcare of Massachusetts has been a strong partner with us. As you know, our Congressman Jim McGovern got us a $1.2 million congressional earmark to support the creation of this resource center for the grandparents that are raising their grandkids or grandchildren, also known as grandfamilies. And you stepped in right away and gave us $170,000 to jumpstart this resource center before the funding from the federal government came. And so I want to publicly thank you and the United Healthcare for being that key partner at the beginning to get this resource center up and running. And as you mentioned that, throughout your caregiver support years in Tennessee and certainly here in Massachusetts, you've seen the older adults that, United Healthcare provides services for, also raising grandchildren or other kin. And the model that we've come up with through the Resource Center is this community health worker model, which we're calling Grandfamilies Community Health Workers. And as a part of the service delivery, John, as you know, these community health workers work throughout our 61 cities and towns here in central Massachusetts to make sure that these older adults and the children that they're raising, that they both have access and quality care. I mean, it's one reason or one thing to see, these families who need the services and support. It's good to do information and referral, but we needed a one-stop shop center. If you come in to our resource center and you're hungry, you need food, you need clothing, you need bill assistance, if you fit the guidelines, what we set out, you're going to walk out of the resource center with a solution. Instead of saying, well, there's this organization we can send you to, or there's this government program that you can apply to, which could take months or weeks to even see if you qualify. So what we've created is really a one-stop shop solution for these families that, oftentimes they get frustrated with the governmental systems because there's so much red tape in terms of when you come in with the need and when you actually get the services, or you find out that you don't qualify for a particular service. So the support that you guys gave early on really helped cement the formation of this resource center, and going forward is really what we've created as a model for the nation on how do you care for grandparents that are raising their grandchildren, and it's through the community health worker model.
Yeah, you're right, Moses. This is first, that was the least we could do. Hearing the challenge that you had and the opportunity that you also had to bring funding into Worcester and to neighboring communities to serve this particular population. It just made sense for United to partner and assist in any way we could to ensure that we could be doing this for our seniors. The work that we do here in Massachusetts, particularly United Healthcare the United Healthcare Community and State, we actually work in two particular programs. One is our Senior Care Options, and the other one is One Care. In our Senior Care Options program, we serve people who are 65 and older, who qualify for both Medicare and Medicaid. And we provide a suite of benefits to support those folks health-wise. So you are talking about covering all their medical costs, dental, hearing, vision, but then we also add other benefits to support their social determinants of health. Like, we provide benefits for food, utilities, and also over-the-counter medications. When you think about the challenges that older adults are facing, those are the things that we think are really important. But to your point, one of the biggest challenges older adults have is, how do I get to all the things that are available to me? Yes. Oftentimes, particularly grandparents who take care of grandkids, they don't have the time and the means to get out of their home every day and go to different organizations to queue up or line up, fill forms, and then get all the benefits that may be available to them. Yes. And particularly in our communities of color,
yes,
we find that whereas it's easy for me and you to just hop in our car and go somewhere and get what we need, for a lot of seniors, that means not only getting the transportation to get there, but what do I do with the grandkids, right? And if you've got more than one, that means you've got to figure out arrangements to take that grandkid with you, get transportation to get to the places you need to get to, and then once you're there, stand in line, fill out the paperwork. And if you've got to go to 3 or 4 places, that could be a week's worth of work or 4 weeks worth of work before you can get all the benefits you need. I think what you're doing with the resource center really makes sense. One place, one-stop shop, as they call it. Seniors can come to one place, they can get all the resources that they need in one location and get all the assistance they need from the folks that you've hired here, so that in one visit, they can get a whole lot more work done and get the benefits that are afforded to them in most cases.
Yeah, absolutely. And so you touched on a lot of things there that I want to kind of follow back up on, and one of the things is this whole access to food, and I commend United Healthcare for providing that benefit to your participants in your health coverage programs. We know that Massachusetts' aging population is growing. Mm-hmm. It's more diverse. And what comes along with that, particularly the seniors of color, they want to have nutritional options that meet their cultural and their medical needs. Yeah. And so that has been a huge issue, particularly with the older adults of these grandkids that we're raising. 67% of them are from Black and brown communities. And that is a constant issue. It's like, people are very grateful for, food pantry, giving them food, but what we're also finding is people also want the personal choice of choosing their own foods. And so how does United Healthcare, I guess you're dealing with that because is it like a card you give them a month? Is it a voucher? Is it, cash assistance to go out, or do you actually give them food and say, here, this is your allotment for the month?
Yeah, so you're certainly right? So most of us want to eat food that we enjoy, and that is also nutritious. And so it is a challenge oftentimes to get people the food that meets their palate, so to speak, or that is ethnically diverse enough to meet everyone's needs. And so how do we do this? So using their insurance card, believe it or not, we're able to actually have our seniors get $125 a month that they can use to pay for groceries, they can use it to pay for utilities, or they can go to any drugstore that they use and buy over-the-counter medications. And so they actually use that same card that they would otherwise use for their insurance to pay for those things. One thing that we're also doing, knowing this problem that you just so eloquently elaborated on, is we're now working with local bodegas and grocery stores that serve in those communities.
Wow.
So instead of just being able to use your card at Walmart and Market Basket and Stop and Shop, nothing wrong with those places. But oftentimes for people of color or people of different ethnic origin, those stores either are too far away for them to go to, or they don't stock the things that folks are really used to eating or would like to eat. And so working with those local mom and pop grocery stores, we're actually making sure that those stores can actually accept the card that our members have. And because that's where they shop and those places are more accessible to them, they can actually go down the street, use their card, and pay for groceries. So we have started to add more and more ethnically diverse stores in our suite of providers, so to speak, that folks can use. So that's one way that we're trying to solve that problem as well.
Yeah. No, I mean, that's just amazing to hear that you guys have sort of coordinated this effort in terms of meeting people's cultural and nutritional or medical needs in terms of food, but you also, from an equity standpoint, you want it to be within their own sort of neighborhood of, those businesses that fit their culture and their needs. So, John, you're going to tell us a little bit more information about the various programs that is offered through United Healthcare and how folks may be able to sign up.
Yeah, so we, as you know, my programs here in Massachusetts, United Healthcare manages, through a contract with Mass Health and CMS, manages the Senior Care Options program that we, commonly call SCO. In that program, we support older adults, 65 and older, who are eligible for both Medicare and Medicaid. So we provide what's called an integrated health plan that integrates all their healthcare benefits, mental health, physical health, vision, dental, and other services that we provide through our benefits package, including things like the food, OTC, and utilities benefit that we also provide. So for folks who want to get these services, there's two ways that you can do that. You can go to our website at uhccp.com/MA, or you can call 1-844-724-6727. And somebody from our sales team will be able to talk you through all the benefits and how you can go about applying for these services.
Well, thank you, John. I want to switch back to our Back to School Fun Fest that we had on August the 12th of this year, which was the first ever Back to School Fun Fest for grandparents that were raising grandchildren. And we had over 3,000 of these families show up to this event. United Healthcare was there and a supporter of the event. And it was just so good to see these grandfamilies who have gotten none or little support over the years in terms of raising their grandchildren. And a lot of the reason why these children end up with their grandparents, as you know, is the substance abuse, substance use crisis, such as the opioid, the fentanyl crisis now, or alcoholism, or unfortunately, some of these parents of these children have succumbed to death. Mm-hmm. And I know United Healthcare does a lot of work in that space on getting folks who need, treatment for these illnesses. So could you talk a little bit about the work that you guys do around caring for folks who are in these situations?
Yeah. One of the things. So first, the event this summer, the back to school event. Thank you for inviting us. I remember you and I meeting, and it was just an idea that
Yes.
you had, and you were thinking about, how could we help grandparents, and I said, hey, if you do ever get there, let us know, and we'll try to support. And I was so glad to see that some of our staff, I think we had a little bit over 24 of our United Healthcare staff from different areas of United, not
Yeah.
just my line of business, which is community and state, but we had folks from Optum and from our commercial line also joining us to support the work that you're doing with grandkids. And I tell you, the reviews that I heard, because I couldn't attend that weekend, I happened to be traveling, was the amount of joy that our staff felt being able to support and help with the families that you're working with. And why is this important to us? One of the things that's really important to us at United is volunteering. When we volunteer, we get to actually have access to the communities that we serve, but it also fills our cups back. We all work really stressful jobs, and we're all running back and forth. And what I find is when we volunteer, we have a way of kind of filling our cups back, re-energizing ourselves, and finding or remembering the purpose of what we do. And so thank you for that opportunity to serve. And I can tell you that we'll certainly be doing it again when the time comes. One of the things that is really important that brings us here, right, that has grandparents ending up with grandkids is the issue of mental illness. And so we know that most of the folks that these grandparents who find themselves in this situation is a result of substance abuse issues. Either a family member, a child, a son or daughter who has succumbed to the illness of substance abuse, who no longer is able to take care of their own child, and so now grandma or grandpa is now responsible. And so as we look at this problem and figure out, how do we meet this challenge, we have to go upstream. And so some of the work that we do, particularly in our One Care program, we also serve people in SCO, in the Senior Care Options program, who suffer from mental illness, is we're constantly trying to find ways to get the care that they need to them. All of our healthcare benefits include behavioral health care. They're integrated into the benefits that we provide. So we have case managers all across the state. So we've got about a little over 350 case managers, social workers, nurses, CHWs, who are working in the field to assess our members, make sure that we know where they are, figure out what their needs are, and then connect them to the services that they need. Working with our partners in Optum Behavioral Health, we are working with a network of providers all across the state to ensure people get to an appointment, get linked to somebody who can provide care. And then where people have difficulty with access, we're also using telehealth now, and people have access to therapists and care providers through telehealth, because we noticed during the pandemic that for a lot of people, the stigma still remains.
Yes.
And going to a mental health clinic maybe not be something that some folks want to do, but we noticed when we opened up telehealth during the pandemic that a lot of people opened up to their mental illness, and using telehealth were able to get access to the care that they needed.
Yeah.
And so we're constantly trying to find ways to help people get access to the care so that we can avoid the very situations that challenge us today, when these grandparents now have the burden of the mental health crisis
Yes.
that we have.
Yeah. And also, in terms of that burden, I mean, the other burden in terms of just caregiver in general is the lack of culturally appropriate or culturally relevant staff or workers to support this growing, diverse, aging population. We certainly see it in our work that we do with our grandparents that are raising grandchildren. A lot of these folks, just like the food, they tend to respond more better to people that understand their cultural more, or have worked with a particular culture in the past. So in United Healthcare, you have hundreds of workers across the state, and I know you guys have taken a particular interest in making sure that the needs of the older adult is match up with their background. So could you talk a little bit more about that? Because that is a growing issue. And let me just say, we are, the people that work in the caregiver space across the state, we're very grateful for their work, because it's hard work. It's very, very hard work. But it's even harder when the folks that are receiving the services are not reciprocal because of these existing barriers, if you will. Because if, for example, if you have a worker that doesn't speak Spanish and they have a Spanish-speaking client and they have to rely on a translator or an interpreter, that creates a lot of challenges, and we've seen it. But if we could figure out a system where we're recruiting more diverse people to work in the caregiver space, which we have, but with the growing elderly population, diverse elders, we need to stay on par with that. So how do we continue to do that?
Yeah, so this is, you bring up a really big challenge, Moses, in the sense that not only is the older population growing, but the diversity of the older population that is growing is also increasing. At the same time, we're seeing a lot of people prefer to do other work that is not this work, right? And so because of this challenge, the workforce challenge, I think we're going to have to think differently about how we approach. And as we learned, I wouldn't say we learned, but it was highlighted in the pandemic. We've always known that health equity was a challenge, but the pandemic was really, I guess you could say, good about exposing some of those challenges that we have. One thing that we've also learned is that most of us prefer to get care from people who look like us, talk like us, understand the cultures that we come from, because they tend to take care of us in a better way. And so most of us would prefer somebody who understands our background and can then provide treatment in a competent way, knowing the things that are most important to us. And so as we think about the workforce, I think some of the things that we're going to need to really do is to recruit workforce that matches the population demographics that we're trying to work with. And so one of the things, for example, that's happening right now is we have an immigrant crisis, right? And as more and more people seek refuge in states like ours here in Massachusetts, what can we do not only to support those folks that are coming in, but to also recruit them to work in places that could also be helpful to us. Now, these jobs are, like you said, very, very difficult jobs. We don't want to just make these the only jobs available to people who are immigrants who are coming in, but is it a way maybe that we can get people to start, support, and then work their way through? I'll give you an example. I've worked, as I said, I used to run home health agencies. I started 2 of them. And one of the things that was really good about working with some of the populations I worked with, I had a really good group of Ethiopian migrants who had come into Nashville who were looking for work. And a lot of them worked as parking lot attendants, for example. And I started wondering, well, why every time I go to a parking lot and I'm parking my car, there's somebody from Ethiopia that's managing the gates. And I started asking questions, and it was really one individual in the city of Nashville who was an Ethiopian who recognized that immigrants who were coming in needed work.
Yeah.
This was the work that he did, and that's how he opened up access to those type of jobs. And so what we said was, well, why couldn't we do this as well, right? And so we tapped into that immigrant population, and lo and behold, we had a lot of folks who were helping us do the work that we do, who were from Ethiopia. But as you said, language barrier can also be a challenge. So what can we do to train people who are coming in, who are willing to do this work? But at the same time, what can we also do to match people to the folks that have similar backgrounds to them, so that they can provide the best care for those folks? Today at United, we're using translation services, of course, but sometimes what we also do is we just don't use the national translators. We use local translators, so that we have people who are closer to the community, understand what people are going through, and can provide that translation service in a more meaningful way, for example. So a lot more work to be done, for sure. But you're right, this is an area that we really have to pay attention to as our older population grows.
Well, John, I want to thank you for your time today. And, I just, on a final note, I often say, when we think about diversity, equity, and inclusion, we often don't think about our older adults and those with disabilities. And certainly the case of grandparents that are raising their grandchildren. And so I want to thank you again and United Healthcare for partnering with us on this resource center, and looking forward to continuing to work with you and your team here in Massachusetts on other ways that we can work together. But it's been a pleasure finally having you on after trying to get together over the last several months, and just want to thank you again for joining us.
Yeah, thank you. Thank you for having me. This has been a really good pleasure, and hopefully we can continue these conversations and find more ways to help our seniors. But kudos to you and your team for the great work that you're doing. You're teaching us a lot, but one thing that I can definitely say for me is what I've learned from you, Moses, is just perseverance. When we have ideas, we've got to persevere, and I think you've built something really, really good here, and I'm looking forward to seeing it come to fruition and having others learn from it as well.
Absolutely.
Thank you for having me.
Thank you so much. Well, folks, that wraps up our second podcast of our Aging Well Together. We want to wish all of you a happy holiday season, and we look forward to seeing you soon, and enjoy your family this holiday. Thank you. Please visit our website at www.seniorconnection.org.